The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to Pain Free Today with your host, Denis Thompson. Brought to you by Worldwide Advanced Medical Technologies, LLC. Call 954-256-0045 or online at painmanagementnetwork.com. Here you will learn how to eliminate your pain. You will learn about a revolutionary new therapy called the ARP Wave System, which treats the neurological origin of pain, not the symptoms. You will learn how to increase your range of motion and how you can move freely without pain at any age. You will learn how you can try one free treatment from one of our local providers. Denis Thompson has 25 years' experience working with top athletes and non-athletes of all types. He has treated thousands of patients with better than a 95% success rate. His list of athlete clients reads like a who's who of the sports world. Listen and find out how the ARP Wave System can benefit you. And now, here's your host, Denis Thompson.
Good morning and welcome to Pain Free Today, and happy Memorial Day to everyone listening today. We today will have a number of callers, I believe, that are scheduled to be on the show. But one of the emails that I received last week, and it had kind of a simple philosophy and a whole lot of questions. But, I mean, it really boils down to what's the most difficult case you've ever worked on. And I get asked this all the time. And I think probably one of the most challenging cases that we've ever worked on with the ARP Wave System was a hockey player who had a concussion. And the byproduct of that concussion is all the muscles in his body immediately contracted concentrically. So he was in a tremendous amount of pain, and he basically felt like he was restricted in every single movement you could imagine. He couldn't raise his arms, couldn't move his head, couldn't dorsiflex or plantar flex his feet. He just felt completely bound up. And when he came to us, he had already seen a number of experts throughout the world. This gentleman was out of Canada. And he was finally referred to us, and we put him into the ARP Wave System. And for those of you who are new to the show, the ARP Wave System is a very unique healing system. It is a new therapy. Unlike physical therapy, this is neurological therapy. And what the premise of the therapy is every condition, every symptom of pain has an origin in the nervous system. So in other words, wherever you feel pain or wherever you have an issue is where that pain ended or the issue ended, not at all where it's coming from. And most providers typically will work on where the problem ended up, not where the problem is coming from, because up until now, there's really not been a very effective way of determining the neurological origin. So the ARP Wave System is a system that is designed to work on the origin of the symptom, not the symptoms. And over the last few weeks, we've been reaching out to practitioners all over the state of Florida, have tremendous results. It brought on numbers of doctors to be providers of our services. And if you are a patient and you have any type of pain whatsoever, and your doctor is not one of our providers, I would strongly suggest that you invite them to be a provider and also offer them the opportunity to where our company will supply your physician a system by which we can treat you in front of the doctor to demonstrate the efficiency and the efficacy of the system. So it is a twofold approach. You can get results, and the doctor can see the benefits of those results. But getting back to our case, this individual came in and the very first thing that we did is we had to test to determine, was the nervous system firing correctly? So in our system, the first step in the system is identifying just that. And the test that we use, we call it an external EMG. And for the providers out there, they're very familiar with the terminology EMG, which is simply a test to determine the electrical impulses. Are they there or are they not there? Well, the nervous system, typically the outward expression of the nervous system is the muscles. So what we do is we test the muscle to determine, can the muscle absorb force? If it cannot, then force is going to be going somewhere that it's not designed to go to, which is eventually going to cause a problem if it already hasn't. So the first thing that we do is our imbalance test. We're testing to see, is the nervous system in balance? And in this specific case, the nervous system definitely was not in balance. And then we did a cognitive test. We had the patient basically count to 100, and in that process of counting to 100, we would tabulate how long it took to get to 100 and how many mistakes they made counting to 100. That would tell us, are they cognitively able to process just that simple task? And in this case, this individual was not. Then we gave him a hand tap test, and what we're doing there is determining the reaction time and how many times he can tap his fingers in 10 seconds. We have a baseline, and he failed miserably at that. So the thing that we had to do is we had to stimulate his nervous system to get his nervous system to activate. And as we tell all patients when we do this, think of this as a resetting of a computer. The very first reflex pattern we all learned how to do on our own is how to crawl. And the way we do that is left, right, right, left. So the right side of the brain drives the left side of the brain drives the right side. So what we had to do is we had to stimulate his nervous system to see if we could basically reset that reflex pattern. And it takes typically about 3 to 4 minutes. After we did that, we then retested him again. And now he was able to absorb force. However, it didn't make any cognitive change whatsoever. So the next thing we had to do is we had to basically elevate the stimulus cognitively to force him to react to that stimulus. And keep in mind that our system is built on a very simple premise, and that is the greater the stimulus, the greater the change. So we stimulated this individual and for about 30 minutes. And at the end of 30 minutes, we did a test again, and the numbers test that we gave him dramatically changed. The number of mistakes he made dramatically changed. And then we went to step 2 of our system. And step 2 of the system is basically finding out where the signal is coming from that is causing the main problem. In this case, the problem of the muscles being in concentric contraction, not eccentric contraction. Now, the difference there is if you take your hand and you open it, think of that as eccentric contraction. And if you close your fist tightly, think of that as concentric contraction. Now, if you'd like to know what this individual is feeling, just close your fist very tightly, bring your arm up into a curl position, and squeeze as hard as you can. Within about 10 to 15 seconds, you're going to feel that muscle contract so violently that it begins to cramp. Imagine that feeling in every single muscle in your body. That's what this individual is going through. So once we identified where the origin of the signal... Pardon me? Oh, we have a caller, Barbara, coming in on the line, and we'll pick up on this story in just a few minutes. Barbara, how can I help you?
Well, hi, Mr. Thompson. I was wondering if you do anything for headaches or migraines.
Well, you know, Barbara, we've been very, very successful with migraine headaches because, again, the migraine headache is the end result of a signal causing muscles to act in an inappropriate manner. So think of it this way, Barbara, that if we find the origin of a problem, we can resolve the problem very quickly. And what we've been able to determine is a lot of migraines, not all, but certainly a lot of migraines, emanate from the muscles in the shoulders becoming very, very tight. And as they become tight, they shorten. And as they shorten, they apply pressure to the base of the neck. And as that pressure is applied to the base of the neck, in most cases, you're going to have a headache. So the very first thing that we would do, Barbara, is invite you to come into one of our providers in South Florida. And if we do not have one in your immediate area, we would strongly suggest that you ask your doctor if he'd be interested in having us basically give you a treatment in front of him or her, and just to demonstrate the efficiency of the ARP Wave system. There's no cost to you, no cost to the doctor. But to give you an example of what you could expect from a treatment, you would not feel it at all. And let me ask you this, Barbara. Is your neck traditionally, is it very stiff? Do you have a hard time moving your head to the left or to the right?
Sometimes, yes.
Okay. And when do you feel these headaches come on? Are they mainly coming on during the day, early in the day, in the middle of the day, or later in the day?
Sometimes they happen in the middle of the night, and they're excruciating. Sometimes there's really no rhyme or reason as to when they come on. I've never really been able to find my trigger points.
And I'm sure you've seen many different practitioners for this?
Yes.
Okay. Well, the trigger point is, and everybody's talking about a trigger point. What a trigger point is basically is the end point. In other words, what causes it. But that's really not the origin of the cause. It's just simply the cause. As an example, if you move your head quickly to the left or to the right and it hurts, people say, well, my trigger is moving to the left or to the right. No. Your trigger is that moving to the left and to the right is sending a signal that immediately contracts your muscle and creates pain. So what we would do is simply try our level best to relax all of those muscles. And if we relax those muscles, think of it as taking pressure off the situation. So if we take pressure off of what we call the occipital ridge, in most cases you're going to have a significant change in your headache. Now, it's going to go away very quickly, but it's not a cure for the headache. Nothing we do is a cure. Typically what we then have to do is you would need to go through a therapeutic program to retrain those muscles not to go back to the position that they were in other words, that balled up fist, or basically allow them to extend out into eccentric and concentric contractions. So in other words, fluidly move between agonist and antagonist, which that simply means, Barbara, that your neck muscles would be very, very loose. Your head would be very, very supple and flexible. You can move your head forward, backward, sideways, with a greater range of motion than you've ever had. However, that stiffness is going to come back because my guess is you've had this for many years. Is that correct?
Correct.
And so what we have to do is we have to then retrain you, and we have to neurologically retrain those muscles to where they don't go back into that bunched up position, therefore causing you a headache. But there's no doubt in my mind that I believe that we can help you. But the way to find out for sure is after the show. Just give us a call here at 954-256-0045, and they will set you up with a local provider. If it is not your doctor, again, I would strongly suggest you offer your doctor this opportunity, and we will treat you at no cost, no obligation, just to prove to you that we can or we can't help you. So you've got absolutely nothing to lose. How's that sound?
So I would need to come in when I had a migraine going on?
That would be the best. However, just because you have migraines and when you're not having a migraine doesn't mean that we cannot identify where it's coming from, but we would prefer to you to be asymptomatic when you come into the provider. So I'm certain you're probably on some form of medication. So, refrain from that medication if you possibly can. If not, take the medication and go in to one of the providers.
Okay. Well, thank you very much.
Thank you, Barbara. Have a great day.
Bye-bye. You too.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Well, we're back, and we'll get back to our story about our athlete that we were treating, and if we get another call, we'll take that call. So one of the things that we found when we did step 2 of the system is that the neck muscles were primarily the contributing factor to the feeling of these tight muscles throughout the entire body. Now, an interesting thing happened when we started treating this individual in the neck is we got rid of all of the stiffness and the restricted range of motion in the neck, and yet he still felt tight throughout the entire body. And so one of the things that we ask every single patient is, well, if you feel tight, you would be restricted in range of motion. Is that correct? And obviously the answer is yes. So in other words, if you were tight in the waist, you wouldn't be able to turn. If you were tight in the hamstrings, you wouldn't be able to touch the ground. If you were tight in the forearms, you would have a hard time doing a forearm movement. So tightness usually means that we're going to be restricted in some form of motion. Well, in this case, and this is extremely important for the providers to listen to, in this case, there was not one muscle that was in concentric contraction in his body, and yet the patient felt like there was. So what we had to do at that point is we had to show the patient that what they were feeling was the past, not the present. And the way to do that is you have to get the cognitive brain out of the equation. So imagine if you felt that your leg was really, really stiff and tight, and someone asked you to touch your leg and it felt like mush. What would that tell you? It creates a quandary. And that's exactly what we were dealing with. So every single muscle in the body from the shoulders on down felt like they were tight, when in reality they were not. So what we had to do is we had to treat this individual and consistently demonstrate to them a task that they felt they couldn't do because of the tightness. We had to demonstrate that they could do that task. The tasks that we selected were touching the ground without a bend in the knees, twisting the upper torso as far as they could, reaching above head as high as they could. Now, in their mind, it was impossible for them to do that. After they saw themselves do those three activities, then it became very clear to them that they could do it. But the ironic thing about this case, and the reason it became one of the most difficult cases I've ever worked on, is because the patient still felt tight, even when they could reach above their head, even when they could put their arms behind their back, even when they could do things they've never done before. They still felt tight. So what we had to do is we had to consistently, day in and day out, neurologically retrain and verbally reaffirm the fact that they could do something that heretofore they hadn't been able to do before. And it was very, very difficult because when you would touch the muscle that they felt was tight, it felt like jelly. But to them, it felt tight. So all we could do is consistently allow them to move freely. There was no pain, just tightness, or a presumed feeling of tightness. So once we got to around treatment number 9, that feeling started to ease up a little bit. And it's going to take another good 10 sessions before I think we can eradicate that feeling. But it just goes to show you that all of these symptoms were basically a neurological pattern, and it was confirmed by the cognitive mind. So the brain was saying all along, I'm tight, when in reality the body was not. But if your brain is telling your body you are something that you are not, you are what your brain tells you you are, even though it's unreal. In other words, not realistic, not in actuality those muscles were tight, but they felt tight. So that became one of the most challenging cases that I've ever worked on. Now, with the system, is it 100% successful? No. But I can almost guarantee you it's 95 to 97% successful, which there's not many therapeutic systems that are. The ARP Wave system is 100% predictable, which means we already know what the end result is going to be before we even start. So we work at the end going to the beginning, not the beginning going to the end. Again, wherever you have pain, wherever an X-ray, an MRI, or any type of scan identifies you have a problem is where the problem ended, not where the problem is coming from. Isn't it ironic that every single identification test, every single diagnostic test, all diagnoses are based on a very simple premise: where the problem ended. We all know that unless you find the origin of a problem, you are not going to solve the problem. Yet we do not have a test that shows us the origin, the neurological origin of that problem. Now, with the ARP Wave system, we believe that we have found that test. We believe that, and can demonstrate it, we believe that we can identify exactly where the neurological origin of that problem is. And for the providers, where that is when there's a neurological breakdown. And where there's a neurological breakdown, there's cellular miscommunication. Every one of the providers listening today understand that if the cells are disrupted, scar tissue walls off those cells. Where that scar tissue is a neurological disconnect. We have a caller coming in. Caller, can I help you?
Hi. I've been listening to your show a couple times now when I get ready in the mornings, and I've heard a lot of what you've been saying about the muscles and the way that the muscles work, and that really makes a lot of sense to me. But I'm wondering what this can do for cartilage. I mean, I've been told that I'm bone on bone, and I just don't really see how helping my muscles is going to make a difference.
Well, that's a great question. It's not going to do anything for the cartilage. It's not going to do anything for the bone on bone. However, it will get rid of the pain and the restricted motion because you're bone on bone. And here's how that works. Ask yourself the question, why are you bone on bone? Have you been told why you're bone on bone?
No.
Don't you think that would be a good question to have an answer to?
Yeah, probably.
Okay. So unless you know why you're bone on bone, you certainly can't solve that problem. Does that make sense?
Yes.
So let's start to look at why you're bone on bone. And trust me, it has nothing to do with you being active, has nothing to do with you being overusing, has nothing to do with age. What it has to do with is your muscles are not acting as a shock absorber to where the forces coming into your body are going into the muscle. And if it isn't going into the muscle, where do you think it's going to go?
Well, I guess into my joint.
Exactly. So if that consistently keeps going on and that force consistently keeps going into the joint, what do you think is going to happen to that area? It's going to wipe out the cartilage. It's going to wipe out all the fluid or the protective fluid. And eventually you're going to be what? Bone on bone, right?
Right.
So think of it this way. If you were an automobile and I took all the shocks off your car, where's the force going to go?
To the car.
To the frame, right?
Right.
And anybody who's ever built a car knows, or anybody who's ever worked on a car knows, that the frame is not designed to absorb force. That's why we have shock absorbers. Well, your body is exactly the same way. The problem with that is we do not look at how the muscle neurologically absorbs force. And until we start looking at that, we are not going to solve this problem. By the way, this happens to be one of the number one surgeries throughout the entire world is knee replacement surgery. Are you aware of that?
Well, I know that I've been told that I will need one at some point down the road.
And I'm telling you that if you get your shock absorbers working, your muscles, to where they can absorb force. And I'm not talking about them getting stronger, because strength and absorption of force are dramatically misinterpreted. I'm talking about the muscles turning on fast enough to act as a shock absorber to take the shock out of your bone and putting it into the muscle. So redirecting the force. And once we do that, you will have no pain and you'll have almost 100% range of motion.
Wow, that seems like it would be great if it was possible.
And the only way to know for sure if what I just said is accurate is go to one of our providers here locally, and I'll give you that phone number where you can give them a call. It will not cost you anything. You can call and get a provider in your specific area. That phone number is 954-256-0045. And what they'll do is they will set up an appointment with you. We will treat you, one treatment only, at absolutely no cost or obligation, to show you beyond a shadow of a doubt that you can move freely where right now you can't. So let me ask you this. When you are bending your knee, like going into a squat as an example, do you feel pain in your knee?
Oh yeah, I wouldn't even dream of trying to squat.
Okay, so if you could squat, it would show you beyond a shadow of a doubt that what I'm saying, not only does it make sense, but it is an effective means of preventing that surgery.
Well, yeah, if I could see that, that would make more of a believer out of me.
Give us a call, and I thank you very much for your call.
Thank you.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Well, we are back, and we had a couple of good calls this morning so far. Typically what I'd like to do right now is we'll finish up this story, and then we'll get into answering some questions that came in over the Internet over the last week. For the providers listening to this show today, we do have a lot of patients who are very, very interested in trying out the ARP Wave system. And I would strongly suggest you give us a call and set up a time where we can meet with you, show you how this system will fit beautifully into your practice, whether you're a surgeon, whether you're an MD, a chiropractor, osteopath. If you're a medical professional, you're dealing with patients who can tremendously benefit from the ARP Wave system. Think of it as adding a new therapy, not physical therapy, neurotherapy. So it's done in addition to absolutely everything you're doing now. It doesn't take away from anything you're doing. So if you're a physical therapist, this does not take away from what you're doing. It just adds another tool for you to be able to help more and more and more patients. So with that in mind, the couple of callers that we had were very, very interesting. And let's get back to the difficult case, because I think it's such a anomaly to hear someone say that their muscles are tight when they're not tight, but yet they truly 100% believe that they are. And if there's anyone out there listening that falls into that category, I can tell you that that is a pattern. And it is a neurological pattern, not a physiological pattern. If it was a physiological pattern, the muscle, in fact, would be tight. When you touch it, it would feel tight. It would be restricted. I believe that all of our compensation patterns are not physiological patterns. They are, in fact, a neurological pattern. I believe that muscle memory is not a physical memory. It is a neurological pattern. So if you think about it in terms of neurology, it adds a completely different complexion to each conversation that you have. So getting back to this patient, as we would bring him through these exercises. We'd have him skate. We would have him stick handle. We would have him shoot the puck. We would have him do all of the exercises that he normally would do, and invariably he would feel tight and restricted. We bring him in off of the ice and test his muscles, and they're not that way. So the way that we finally broke this cycle is we hooked up our proprietary technology to him, and we had him mimic every movement that he felt restricted in. And once we got through all of those movement patterns, he finally understood cognitively that what he thought he was, he wasn't, and what he thought he was feeling, he wasn't. And he was now able to demonstrate fluid movement. More importantly, it felt fluid. So I think that was probably the most challenging and difficult case that I've ever worked on, because it was a case that I call unreal, meaning that all of the symptoms were real to the patient, but in reality were not physiologically demonstrated. And that is a very, very challenging case. So, as you can see, everything that we do with the ARP Wave system is rooted in a very, very simple premise. And that premise is, wherever you have pain, wherever you have symptoms, is where the problem ended, not where the problem is coming from. So people say to me all the time, and we're asked all the time, well, what about this, and what about this? What about an ankle sprain? What about trigger finger? What about arthritis? What about all these different conditions? Well, those conditions are all where the problem ended up, not at all where the problem is coming from. As an example, if you cannot open your hand, if it is in a fist and you cannot open it at all, and you go to numerous specialists and they do numerous tests on you, and they identify that under no conditions are you going to be able to open your hand, so there's a couple of solutions. One of the solutions would be surgery to release the tendons. Another option might be to go through therapy to consistently try to open the hand. But in the ARP Wave system, we would look at that condition in a completely different manner. Having the hand closed is not the problem. Opening the hand is not the problem. The problem is, why is the hand in that position? And when you can answer the question, why, you can solve the problem. Until you can answer the why, you'll never solve the problem. Everybody works on the where the problem is. Very few work on answering that simple question, why? And if you answer the why, the where goes away. So in other words, if we treat you where you have pain, you will still have pain. If you take medication for the pain, you will still have the pain. But if we treat you where the pain is coming from, you will not have pain, because you got rid of the origin of the pain, not the pain. You work on where the problem ended, you're going to be working there a long, long time. And if you don't believe that, take a look at our medical system and how it operates and the functionality of it, and more importantly, the financing of it. You look at medication, look at therapy the way we do it right now. if we're consistently working on where the problem is, we're not going to get rid of the problem. Therefore, it's going to be extraordinarily expensive. Imagine what would happen to our healthcare system if all of a sudden we figured out where the problem was coming from. Imagine what a reduction in costs that would be. Imagine what a change in quality of life that would be. I believe that we're on the right track. I believe that with the ARP Wave system and with the providers that we're setting up all over the world, we'll be able to demonstrate a dramatic reduction in healthcare costs and a dramatic increase in quality of life. I mean, we heard from a caller today, sounded very young, who's bone on bone and thinking about surgery. You know, we talk to lots of people who have had surgery and are still struggling with pain. We talk to lots of people that have had surgery that have had to have multiple surgeries. Why would you need to have multiple surgeries if surgery was the answer? Why would you need to have all of the medication that we're taking? And South Florida is probably one of the heaviest consumers of pain medication in the United States. Why? Because we have this vast number of people out there who are suffering from pain, and we're treating where it ended. We are not treating where it's coming from. And when we're using medication, we're masking where it ended. So the medication wears off and the pain comes back. Imagine if there was a way of reversing that. Providers, I believe we have that way. Patients, if you have pain and you are in the metro area, give us a call, 954-256-0045. Find out who our providers are. If your doctor is not one of our providers and you want to be treated by the ARP Wave system to see if it will help you, talk to your doctor. Ask your doctor if he would be or she would be open to this. Give us a call. We will set that up. We will treat you at absolutely no cost, no obligation, one treatment. That treatment will prove to you beyond a shadow of a doubt if we can or we cannot help you. It is that fast. Because once you find the origin of a problem, the symptoms vanish very, very quickly. And when I'm talking about very, very quickly, I'm talking about seconds, not months and weeks, seconds. And then what you have to do, if we've been successful in that first session, is you must go through therapy. Because what the therapy does is it neurologically retrains your body to redirect the force to where it's supposed to go instead of where it has been going. So if you have pain, and if you're a provider who deals with pain, please, you've got absolutely nothing to lose. Check this out. This is not a test. This is not an experiment. We've treated over 75,000 patients all over the world with better than a 95% success rate. We're now bringing that technology to mainstream medicine. We're aligning ourselves with surgeons. We're aligning ourselves with medical doctors, chiropractors, osteopaths, podiatrists, physiatrists, physical therapist, occupational therapist, anesthesiologist. We're aligning ourselves with the top experts in their field, allowing them the opportunity to offer a new service, a new way of addressing an old problem. Neurotherapy, not physical therapy. We'll be right back.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida Provider Network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Well, we are back, and thank you. And once again, happy Memorial Day to you. Welcome back to Pain Free Today. What I'd like to do right now is we've been flooded with emails, and one common tendency, I would say, of all of these emails is asking us to diagnose them. We do not diagnose anything. We leave that up to the providers. We can answer questions about how we've been successful with different conditions with different providers throughout the world, but we do not diagnose. We're not doctors. We're not here to help diagnose anything. All we're doing basically is answering questions pertaining to conditions that people have had that we've treated. One of the probably the most common question I'm asked via email or in person is, what about TMJ? What does the ARP Wave System do for TMJ? Well, first off, I think TMJ is probably misdiagnosed about 60-70% of the time. I think it's more like TMD, not TMJ. And for the providers out there listening, they'll understand that terminology. But let's talk about some of the symptoms that some of these patients have with TMJ. Very difficult to open their mouth, hard to chew food, jaw cracks all the time, a tremendous pain in the jaw. Usually they're having, when they see their provider, whether it's a dentist or some other type of provider, they'll either be in a brace, a splint, some type of implement. They'll be taking medication, and worst case will be a surgical intervention. So let's kind of look at how we look at, through the ARP Wave System, TMJ or TMD. First off, think of it this way. And again, remember we talked earlier today about taking your fist and closing it as tightly as you can. Well, imagine the muscles in your jaw being in a balled-up fist. Are you going to open your mouth? And of course, the answer is no, you're not. It's going to be very, very difficult to do. Okay, so if you're working on giving those muscles a medication to relax the muscle, are you going to be successful? Well, I submit to you, no, you're not going to be that successful because, A, the reason, in other words, the why are the muscles in that position? Why are they in protection? Why are they so clenched? Why are they in concentric contraction? Unless we can answer that question, like I said earlier, why is this the case instead of where is this the case? I mean, everybody knows where it hurts. I have never met a patient yet who didn't know where it hurt. Conversely, I've never met a patient yet who knew why it was hurting and where it was coming from. So everybody knows the where. Very few know the why. So ask yourself, why is my jaw muscles so tight? Why are they tight? Why don't they allow my mouth to open up? Well, the answer is they're getting a neurological signal. Key word is neurological signal. No matter how much you try to change that signal by manual manipulation or bracing or even in some cases surgical intervention, you have not stopped that signal. And as long as that signal is going on, the symptoms are going to be the same. That's why this is such a tremendously confusing condition, whether it be TMJ, which is a joint problem, or TMD. Now, there's many, many, many different treatments for this condition. I submit that most of these treatments, not all, but certainly most of these treatments do not take into effect the fact that the muscle is getting a neurological signal to protect. And if that, in fact, is the case, no amount of manual manipulation, no amount of implementation is going to change that symptom. Reason being, the signal is still there. What we've been very, very successful at doing is relaxing those muscles. Now, I don't ever believe a muscle relaxes. I think that's a very poor choice of words, but everybody understands the word relaxes as far as opposed to, going to eccentric contraction. But a muscle contracts by lengthening and it contracts by shortening. When a muscle is protecting you, when it is getting a neurological signal to protect you, the muscle shortens. When it shortens, it restricts. And generally speaking, when it shortens, it hurts. Remember how I had you close your fist and ball up your bicep? It hurt. Well, imagine your jaw muscles being in that position for 5 days, 10 days, 10 years. Imagine it becomes a way of life, a pattern. And that pattern is very, very uncomfortable. So the way we've been successful is we send a signal into the muscle which allows the muscle to go to eccentric contraction. In other words, instead of a balled up fist, an extended hand. The second that happens, and folks, it takes seconds to do that. The second that happens, that patient who has not been able to open their mouth and put one finger in is now going to be able to open their mouth and put 2 to 3 fingers in. Now, for the providers out there who deal with TMJ, just because you get them to open their mouth and just because you get them to reduce that pain and just because that's done in that first session does not mean that solves the problem. What this is a neurological problem. It is a problem that there is a neurological signal sending and going to these muscles to protect that joint. Force going into the body cannot be absorbed by a muscle in concentric contraction. Physiologically impossible. So all the force keeps going into that area. So anytime you open the mouth, anytime you eat, what's going to be happening to that muscle? That force is not going to the muscle, it's going to the joint, irritating the joint, creating inflammation in the joint, and now you have either TMJ or TMD. So think of it this way. If you could get rid of the origin, in other words, the why, if you could get rid of the why, the where would go away. One of the things that we found with TMJ patients is that the neck muscles are very tight. The scalenes are very tight. A byproduct of TMJ is headaches. We talked to someone earlier this morning about migraines. A very, very similar situation. The trapezius muscle shortens, goes into concentric contraction, puts pressure on the occipital ridge. Well, imagine what happens when you manifest that up into the facial muscles. The same thing happens. The muscles tighten. They can't absorb force. Therefore, they restrict motion. Guess what motion that might be? That would be opening your mouth. And all of a sudden, you've got a problem on your hands. What we do is we neurologically retrain those muscles because it is needed to create a new pattern. That pattern is being able to open your mouth freely without pain. Many people with TMJ or TMD have had this for years and years and years. It doesn't just come on. There's a reason. And that reason is somehow, some way, the nervous system is sending a signal to those muscles to protect you, to protect that joint. Force has overloaded that area, and it can't handle it anymore. All we do is basically take those shock absorbers, retrain them to do what they're supposed to do, and now, for the most part, most of the symptoms of TMJ will be gone. The ability to open the mouth will be enhanced dramatically, and you'll be able to chew without any pain whatsoever. Now, is it a cure? No, it's not a cure. It's a solution by simply changing the neurological pattern, because that's what we're dealing with. We're not dealing with a physical pattern. We're dealing with a neurological pattern. Well, I hear a sounder coming on. Again, thank you for listening to Pain Free today. If you have any questions, would like them answered for the show next week, give us a call at 954-256-0045. And if you'd like to communicate via email, contact us at painmanagementnetwork.com. Until next week, have a great day.
You've been listening to Pain Free Today with your host, Denis Thompson. Denis is the creator of the ARP Wave System. Send in your questions for next week's show to questions@painmanagementnetwork.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
This is Health and Wealth Radio,